we've had a really fantastic lineup and programme for this, what is our 30th annual Health Promotion Conference here at the University of Galway. So we've had a fantastic day of keynotes, of oral presentations, poster presentations, interactive workshops and lightning talks. This really has been a very, very packed schedule and programme of events.
Hello and welcome to the HSE Talking Health and Wellbeing podcast. We're here today at the University of Galway for the 30th Annual Health Promotion Conference, where the theme is Promoting Wellbeing Through Equity. The conference is supported by us in HSE Health and Wellbeing, as well as the Association for Health Promotion, the Department of Health, Healthy Ireland, and the Health Promotion Research Centre here in the University of Galway. It's always been an important event in the calendar, and this year we celebrated 40 years since the Ottawa Charter, which was a foundation framework for health promotion internationally, and we also celebrated 30 years of the conference itself. But it was also a sad occasion with the recent passing of one of our highly respected colleagues, Professor Saoirse Gowan. She worked for over 30 years as an academic, public health researcher and Professor of Health Promotion at University of Galway, making profound contributions to adolescent health, sexual health, health equity, and she was fondly remembered by colleagues during the day. So we have a range of voices for you to hear from today, and some of our keynote speakers to many of the colleagues presenting on the theme of equity. As always, please share the episode with anyone you think might get value from it. So Martina Blake with the HSE Tobacco Free Ireland programme is joining me now. And Martina, what has the HSE Tobacco Free Ireland programme brought to the conference today in the line of equity messages?
We're obviously very focused on health inequality in the Tobacco Free Ireland programme because we have stalled smoking prevalence, but we have much higher smoking prevalence in more deprived groups. So we're delighted to be here at the 30th anniversary conference in health promotion, and we've had an opportunity to present some of our work in that space. So we have a financial incentives stop smoking programme going on at the moment, and we're doing a workshop this afternoon.
So the financial incentives is paying people as part of their quitting journey?
That's right, yeah. So we've had a pilot programme going on for the last 15 months, and we're paying people vouchers throughout their quit journey. And we know that that works in terms of Cochrane review. And what we're trialling at the moment is the implementation of it in an Irish setting. It's the first financial incentive for health behaviour change that we know of. And the results are really interesting in terms of engaging the right population and really successful quit outcomes as well.
So fundamentally, everything that you're currently doing in Tobacco Free Ireland has to be inequality focused.
It has to be. Because we have globally, I suppose, reduced smoking prevalence over the last 10 years. And now we're at a key tipping point where we need to get focused in on certain population groups to try and bring tobacco to an end game and reduce smoking prevalence to 5%, which is what our goal is, our government goal.
Yeah, listeners may be aware of a podcast we had a couple of podcasts ago with Dr. Paul Kavanagh in relation to the tobacco endgame, but in terms of the other things that you're doing in relation to reaching those potentially hard to reach groups and what you're sharing today.
Yeah, so we're also presenting some work that we've been doing with the Irish Prison Service. We've been working with the Prison Service now for more than 10 years actually on tobacco-free environments. And we're training inmates in smoking cessation and supporting staff internally in the prison service to try and address smoking cessation, and also providing access to inmates in prison services to the quit line, which was kind of a new initiative as well, because previously inmates only had, limited phone access to family and friends.
Quit line is the phone support service that's offered for everybody. But
that's right. Yeah. So now it's one of the numbers that inmates have an ability to contact if they're on a quit attempt and they're engaging with the programme. And they're also support internally because we have trained staff, volunteers within the prison service, as well as the nursing staff and health promotion staff that also work in the prison service.
And I know that free NRT has been a big help to the tobacco cessation work in recent years. Have you been able to integrate NRT into the prison setting?
Yeah, so prisoners have access to free NRT. We first started working with both prison workers as well as prisoners themselves. At that time, we didn't have free NRT for everybody. That's another thing that we're presenting here today is the implementation of free stop smoking medication and the impact that has had on our numbers.
Has that been the biggest game changer that you've seen?
Absolutely. That has been the total biggest game changer in terms of stop smoking care in the last 4 years. We have doubled the number of people that are coming to service.
Well,
because money was obviously a barrier. People had access to the free behavioural support, all along for the last 10, 15 years.
This is the counselling sessions, either face-to-face or quitline.
Yes, they had access to that, but they weren't engaging because they had to pay for the medication. And the medication is, okay, it's cheaper than smoking, but because you're paying it in bulk for a month's supply,
it's not free, yes.
It's not, yeah. So when we introduced free medication through the Sláintecare investment that came in 2022, we have since that time doubled the number of people that have come to service. We've increased the number of people who are using medication in their quit attempt up from 50% to 80% or 78%, almost 80%. And we know that if you use medication and you use that intensive behavioural support, your likelihood of being successful in a quit attempt is much, much greater. So we want more effective quit attempts. So removing the barrier of having to pay for life-saving medication, which is what it is, had a massive impact in terms of stop smoking care in Ireland.
So there's the financial incentives you're showcasing some of the learning around NRT. Is there anything else?
And the prison work.
On the prison work. Okay, great.
Yeah.
I appreciate that the tobacco work is such a priority across the health service, across society, that some people sometimes may forget how important it is.
Yeah, a lot of people think that we've reduced smoking among the general population and it's less obvious that we're done. We've finished with that. There's other agendas. But really, population level, it's still at 17%. Among low-income communities, it can be 25, 26% in some communities. And among particular migrant groups, it can be double the national average.
So it's a driver of inequalities as well as an outcome of inequalities.
Absolutely. Absolutely.
I'm joined now by Professor Margaret Hodgins, who led a beautiful tribute this morning to Professor Saoirse Ní Gabhain, who sadly passed away last week, who was a vital, important staff member of the Health Promotion Research Centre for many years and lectured me and many others in health promotion in Galway for many, many years. But Margaret, you led a beautiful tribute. It was very important today.
Thank you, Virgil. Yes, we're all very, very saddened at the loss of Saoirse. She's been a member of our staff for 33 years. She's one of the longest serving staff members in health promotion. And as I said this morning, it's really hard to even imagine health promotion here in Galway without Saoirse. So we're really going to miss her. She was a valued colleague and she was always so committed to health promotion. And she led the Health Paper in Schools research project. So she successfully secured that contract every sweep since 1994. And she was involved internationally with several of the working groups within the HPSC. And she built a team around her. And she inspired and supported so many other people researching health promotion, researching the health of children and young people. And she was particularly interested in the voice of young people. And she set up projects about participation. And she felt very strongly that young people should be consulted on matters that pertain to their health. And she was to the forefront of that work, I would say, here in Galway.
I would have always seen her as a force in nature. Like she was always very determined and focused on the work.
She was just totally committed to health promotion. It was her academic and intellectual home. And she was a driving force within the Health Promotion Research Centre. There's no doubt about that, and we're going to miss her so much.
I appreciate that this is so raw.
It is.
For, the funeral only recently taken place. But you're planning to dedicate next year's conference to her.
Yes, next year's conference will be on children and young people. So we have chosen to dedicate that conference to Saoirse and her work and her legacy.
We're now joined by Dr. Helen McAvoy from the All-Ireland Institute of Public Health. Helen, the theme of the conference today is equity. Why is it important that we're talking about that?
It's a really important time to talk about equity and health inequalities, both in Ireland, I think, and internationally. We are looking at a new population health framework to improve the population's health and to provide everyone with the best opportunity for health. So it's a great time to be having a lot of discussions around health inequity, what it means, what are the drivers, where's the best return on investment, how we need to change the way we develop our policies and our programmes and services.
In terms of the pieces that your organisation and colleagues are showcasing today, can you tell me a little bit about that?
Sure. The All-Ireland Institute of Public Health has developed a new health impact assessment training course, and health impact assessment is a practical tool to really look at the potential health effects of different policies, programs or projects before those projects and policies are implemented. So health impact assessment is a skill. It's a ability to identify what are the risks and opportunities to ensure that health and well-being is optimised within decision making. So it's not just for health policy, it's across social policy, environmental policy and planning. So we launched our new comprehensive training course on the 1st of May. There are accredited and non-accredited pathways, and the course is open to, of course, people interested in health promotion, in health services and in health roles, but also we're really interested in engaging people who are involved in environmental impact assessment, strategic environmental assessment, local planning, local government and people involved in the community and voluntary sector to try and build a workforce that can help ensure that when we make these decisions around national policy or local policy, that we've thought about health and we've thought about health equity and we make the best decisions possible.
Yeah, it's so important that we think before we act. In terms of all the talk and hear about influence and policy, it's easier said than done, so we have to be careful about what we do. And the health impact assessment is a way of proofing that, isn't it?
Definitely. And we've certainly seen from Wales, they've been trying to, move forward with ensuring that health impact assessment is there for some of the large capital infrastructure projects that the government is progressing and so on. So it's a skill and a set of skills that's applicable whether you're working in a small community organisation or whether you're working in area regional planning or whether you're working in neighbourhood regeneration. All of these areas, health impact assessment can help you understand, well, what does this mean for health? And how would I look at the evidence? Who do I need to consult to understand the health impacts of this decision? So, as I said, the course has gone live. We've done a lot of work in developing it, piloting it, testing it, and we've worked with the University of Liverpool, with HIA experts and with Public Health Wales to provide a much better HIA training offer than we had before.
Great. And I want to ask you about your other piece in relation to, is it sunbeds and young people?
That's right, yeah. I mean, it's very fitting that we're presenting our report around sunbed use in Ireland and the implications for skin cancer prevention. And on two fronts, it's an extremely hot day today, so we all need to protect our skin from the harmful effects of UV radiation. But secondarily, we worked very closely with Professor Saoirse McGowan here in University of Galway to include data on children's sun protection behaviour and sunbed use. That partnership meant that Ireland was the very first country of all of the WHO HBSC participating countries to include data on children's sunbed use. And when we got to use that data for policy, it really provided us with a clear picture around the extent of sunbed use for children. So the report that we presented today looks at sunbed use, data that we got from surveys. It also looks at data from the HSE, National Environmental Health Service, which works extremely hard to monitor compliance within the sunbed sector. We looked at some evidence internationally in terms of what gives us the best return in terms of reducing the risks from sunbed use. I know the HSE National Cancer Control Programme are currently running a number of campaigns around sun protection and sunbed use. So it was a timely report for us to present today. Department of Health Sunbed Working Group have published their report, and we look forward to seeing the next steps in relation to a new set of regulations on that.
I'd like to welcome Dr. Louise Poinvin to the podcast. Louise, you're one of the keynote speakers today at the Galway conference on health promotion and equity is the big theme. Tell us a little bit about your presentation today.
Okay, so I'm here as the president of the International Union for Health Promotion and Education, which is a global network of health promoters. It's the 40th anniversary of the Ottawa Charter, so my presentation is, and the time they are unchanging, so will health promotion.
How do you think we need to change in the context of equity?
Well, in the context of equity, we need first to get back to basic. And the Ottawa Charter was very, very clear. Health is produced in people's everyday life with the material they have at their disposal for them in their everyday life. Now, these materials are highly inequitably distributed in settings in where people live, work, play, and love. So the recent report from the World Inequality Lab just mentioned that not only are inequalities persistent, but they are increasing. An increasingly smaller proportion of people get holds and commands an increasingly larger proportion of the global wealth and the global resources. So the world is changing, is becoming increasingly inequitable. And it's becoming as well increasingly unsustainable. And it's going to be the same people who will suffer more from the climate change, the climate disturbance, the loss of biodiversity, who will also pay the price for that. So I guess that going back to our basic in health promotion, that equity is our overarching goal and overarching value for which we take action, I believe that we should widen our partnerships. There are a lot of people out there in social movements for climate change, for environmental equity, and we should join with those people. I'm not sure that our allies in the healthcare system that we've been working with for 40 years are the only one we should be aware of and the only one we should be reaching out to work with.
So you're talking about increasing our network of influence and working with new partners.
I would say like-minded partners who have some idea of justice, some kind of will to make this world a better world for everybody else. And not only for humans, but also for the whole planet.
It's all connected in the context of...
It's all connected. And we've been putting a lot of emphasis the well-being of humans, rightly so. But we cannot work for the well-being of humans ignoring the biodiversity, ignoring the planet on which we're living. And I believe that the past 40 years, we've brushed up competencies and we've developed practices that will be of help as well for those people. So I think that we have something to give and something to gain as well by broadening our partnerships.
So it's very interesting. So your positive take on the next step forward is that, we've learned a lot over the last 40 years. What would you see as some of the big achievements on the back of Ottawa?
I think we've made a difference in people's life. We've taught the healthcare system to listen more to the needs of the people and not to the perception of the expert and not to the solution, expert-based solutions only. I think that what we've taught public health and the healthcare system is you cannot make people healthier. You have to help them to be healthier.
Okay.
And I think that we can as well expand this knowledge to other activists, that we will not change the planet against the people's will. We need to work with them in their everyday life settings. And just to make life better for them will make life better for the rest of the planet.
Yeah. So how long are you in Ireland?
I arrived in Dublin last Saturday and I will be leaving this coming Saturday.
And what's your take on Ireland? I know that you've worked with some of our colleagues in the past in health promotion in Galway.
I'm very aware that Ireland is one of the two places where in the world now where health promoters is a profession. It's a profession with a set of competencies that are recognized with accreditation that is needed to work in health promotion. So for health promotion, the distance that Ireland has made in the past decades is important for the rest of the world to follow. And that is to be commanded together with Australia. That's a leadership role that I hope you will be able to expand outside of this island.
So another one of our keynotes is with us at the moment, Dr. Jonathan Heller, all the way from Wisconsin in the US. Jonathan, you're very welcome to Galway. You're very welcome to the conference. Tell me about your keynote presentation today.
Thanks for having me here. The work I do really focuses on how we advance health equity and coming from the perspective of structural determinants of health. And we define structural determinants of health as the set of written and unwritten rules and the power dynamics that create conditions in our communities that then go on to create health outcomes. Our argument is that if that's true and we want to change the conditions in our communities, to change the social determinants of health, we need to change these written and unwritten rules. And these written and unwritten rules are really things like the policies and our laws that Sharon was just talking about, but also our ways of thinking, the narratives, the ideologies that essentially shape what's possible. It's also the way we govern ourselves. It's institutional practices. There's a set of rules that really create these community conditions. If we want to change those rules, then we need to also change power dynamics. And currently, the rich and the wealthy have a lot of power in our society, and the people who suffer, the marginalized communities suffer poor health outcomes have very little power. And so we need to really focus on changing power dynamics. That's the crux of my argument.
So we just listened to Dr. Sharon Friel's presentation from Canberra, and she was talking about similar themes of public health. And Louisa was also touching on some of the elements out of the Ottawa Charter, how we need to mediate with maybe new partners or
yes,
empower parts of our community that haven't, as you say, they haven't had their voice heard. It also seems to be pushing us, if we want to change the systems in which we live, it's taken us away from a lifestyle focus in terms of getting us to advocate and work with partners that are creating those conditions. We're branching off into different key policy areas.
Absolutely. And I argue that this is a major strategy shift for public health, but it also is going back to where public health came from. In the United States in the late 1800s, public health emerged from social movements. We were working with labor groups and housing groups, fighting for better working conditions, better housing conditions, sanitation, better environmental conditions. And then in the 1920s, when bacteriology emerged, we went a different way. We became very much more focused on being objective and lab science and medicine, and went in that direction and left the social movement work behind. I'm arguing that we need to go back. And I think Sharon and Louise were also arguing that we need to go back to our roots and pick up that social movement work. And in particular, in the United States, there's a lot of work that's going on in a field called community organizing that I don't think is very prominent here in Ireland. It's similar to labor organizing, but in communities. And I think we need to be working with community organizing groups so that we're building the power of communities that are currently marginalized and partnering with them so that people power becomes a source of power for public health that can combat economic power, ideological power, the other kinds of power that really Sharon was just talking about as well.
Two things that we've been using in recent years to try and reach those communities is having more community partners. We've definitely increased our base of community partners, what we call Section 39 organisations that have partnerships with the health service, but also the local authorities working on health and wellbeing has been an emerging part of Healthy Ireland in recent years. And they're more explicitly looking at social determinants. The health service haven't traditionally been able to influence social determinants, but there's more partnership and collaboration going there. But I think we need to see some of that collaboration at a national level or be seen to be integrated. Like the Healthy Ireland, our government framework, has a cross-departmental agenda, but that's still easier said than done, obviously.
Yeah, so I completely agree with all that, and I'm going to throw one more component into the mix. Are you familiar with a housing organization in Ireland called CATU?
No.
They organize the Community Action Tenants Union.
Okay.
I think maybe based in Dublin, but I think it's got branches across the country. And they really build community power. What they're trying to do is bring ordinary folks together who are suffering from problems with housing, rents that are too high.
Which is a major issue in Ireland today.
Huge issue, right? But they're bringing those folks together to develop leadership among them that then can basically force policymakers to do things differently.
It's a community development and pushing that through the policy lens.
Absolutely. I mean, if you think about a labor organizing group that's organizing within a particular labor site, their work site, this is essentially doing the same thing in a community, going to the community, asking them what the problems that they have are, and then moving them through, developing leadership so that they can identify solutions to those problems and then try and implement those solutions. If we can partner, if we can use those same kind of community organizing tools within public health, building that people power, we can then, we have this base of people who are supporting the work we're doing. We're working on the issues they care about. We're addressing the social and structural determinants of health. We're advancing health equity. Those are the kinds of partnerships, in addition to the cross-governmental and with the traditional public health service kinds of nonprofits that are out there. I think that's another group that we need to throw into the mix. What really brought me into public health was doing health impact assessment. That was directly from what the Ottawa Charter was arguing for. The ideas have really changed about what creates health since then. I think the ideas about what government can do to advance health and its responsibility for doing that have changed. This understanding that social determinants exist, that housing and transportation and all these other things affect our health. It's new information for most people out there still, but the Ottawa Charter has really advanced the conversation so that has become much more common.
Biddy O'Neill is joining us now, and she's currently working in the Department of Health, Healthy Ireland, a programme lead there, but she's been heavily involved in health promotion, health and wellbeing over many, many years. And you spoke earlier, Biddy, about the 30 years of the Health Promotion Conference in Galway, 40 years since the Ottawa Charter. You had some fantastic reflections.
Yeah, 40 years since Ottawa gave us the mandate in Ireland for the first health promotion policy, our strategy, which was launched in 1995, which set the scene for many years to come. And I think the other important milestone at that stage was the establishment of the Chair of Health Promotion in Galway, where the whole research and academic foundation was laid. And they developed the first professional course. So many graduates emerged from that, building capacity for people to work in health promotion. And health promotion was recognised as a professional role in all of the different areas of health and in the voluntary sector. So it has evolved very strongly. We've had a lot of challenges. We were hit heavily by the recession in terms of the workforce, and that issue was raised, how health promotion not seen as an essential service and can be diluted sometimes in terms of assisting in other areas and the fallout from that. But I think it's really important that we keep our foundation and we keep building. We have policy to support that, like there's a lot of national policies that drive this whole area, whether they're Healthy Ireland, individual policies in relation to lifestyle topics. We have a lot of development across the settings and some really interesting research coming from all those areas. So I think we have a really good foundation and a really good base. I think for me, one of the things in reflecting on Ottawa is that it's still very relevant today. And I think Louise put it really simply in terms of what we can take from it and how we can build around it, and that we need to broaden the base as well to include the other challenges like digital health and planetary health. But also I think in Ireland we've had a bit of an identity issue around health promotion, and we have moved the posts between wellbeing, health promotion, health improvement. And I think going forward we need to reclaim that as our professional identity, because it's a much broader role in terms of the empowerment, the capacity building, community engagement. There's so many other elements to health promotion.
Yeah, I want to touch on there. You're receiving a Lifetime Achievement Award today. You've been working in this field so long. I know in the health service for many years you were heavily involved in the area of tobacco, in mental health promotion, in schools health promotion, men's health in particular. You're still working in many of those fields, but I know since you went into the department, you've obviously led the place. You were on our podcast previously talking about the Healthy Workplace Framework, mental health promotion in the department, and a number of other things in relation to settings. So I hope you appreciate how much you're appreciated and your input over the years.
Thank you, Fergal. I'm very touched. I was very touched when I got the call from the AHPI that they themselves in Galway were giving me this award. It's a huge recognition for me, as in a recognition for the work as I see it. I've been very fortunate. I've loved my career. I have had challenges along the way, but I have been very fortunate to be involved in work and working with great people who are passionate about this area as well. And that's, I suppose, one of the things that's always struck me was people who come into health promotion have a passion for social justice, have a passion for equity, have a passion for community, and they bring that passion with them into their work. So I've been very privileged to work with so many people. I've had the opportunity to influence change, which was really great opportunity, but also it was who was around me very often at the time in terms of the leaders that I was able to influence change. So it was never a planned career. It evolved.
You initially came in nursing?
I was nursing first, and then I spent 10 years in addiction counselling. And it was through that I tipped my toes into education about alcohol was my starting point. And then I came in to the South Eastern Health Board in 1993 as a health education officer for primary schools with a map of the South East and a list of 400 schools and wondered, where do I start? But yeah, it's been an incredible journey, and I've thrived on it, literally thrived on it. And I've really also enjoyed the last few years in the department because there's a real opportunity to influence policy. And if we don't have policy, we don't have the mandate. And yes, it's been great.
Department of Health are leading on a new
Healthy Ireland framework.
Yeah, so that'll paint the picture for the next few years.
For the next number of years, taking account of some of the changes, discussed this morning, taking account some of the issues that have emerged in the research and the consultation, and pulling all those together, I suppose, in terms of making a plan to move forward. There's still an incredible amount of work to be done, particularly cross-government, cross-sectorally. There's an awful lot more that we could achieve. And I think the last presentation before the break there from Sharon in Australia threw in a whole lot of other issues into the mix in terms of how we look at things and the need to maybe take a different perspective in how we look at equity.
There are a number of information stands at the conference here today, and I've just asked to speak with Ellen Lydon from the Patient Advocacy Service. Ellen, you're very welcome. Tell us about the Patient Advocacy Service.
Thank you very much. So the Patient Advocacy Service, it's a free, independent, external organisation to the HSE. So we provide empowerment advocacy to people who are going through the complaints process in public acute hospitals and public and private nursing homes. So we are there to support people to navigate the policy and process that they will be going through. And this could be through different means. So it's personalised depending on what the person is going through and what kind of support they need.
I suppose it's very important in the context of equity as well, isn't it? Like helping people that may need support to get their rights heard.
Exactly. And it is that piece about, having the person's voice heard, which is at the centre of our values, and ensuring that people are informed about the process and procedure and are given that confidence and empowerment to go through the process, which can be very difficult for some people.
So you're highlighting the service today to the people attending the conference, but your day-to-day would involve helping people navigate the systems.
Yeah, exactly. So it could be anything from researching something and telling the person about a policy that they can use in their complaint. It could be just helping them to write a complaint letter and give advice about that. Some people need support with literacy, and we are there to support in many different ways. We can also attend a hospital or a nursing home to support a person in a meeting and to just sit with them really and go through everything together and help them to, have the confidence to get through the process and hopefully to have the resolution and outcome that they're looking for. And at the same time, we run reports to the Department of Health every month. So all the issues that are coming up again and again, they are being highlighted, and slowly that can help to make changes. I'll give you the national phone line. It's 0818 293 003. So the national line is open Monday to Friday, 10 to 4. You can call up and speak to an advocate or advocacy officer if you have any questions or queries about the process. If you don't want to request the support, that's fine, but we are there to help you if you have any questions about it and you want to start the process yourself as well.
With me now is Nicola Briggs from Southeastern Technological University, where she's studying down there. She's doing her PhD, and she did an oral presentation. Tell us, Nicola.
Yes, thanks, Virgil. Yeah, I did an oral presentation, which was a snapshot of some of the research we found from my evaluation on Ireland Lights Up, which is a community walking initiative in the GAA that takes place across the whole of Ireland.
The Lights Up initiative has done really well in recent years, and it's been kind of rolled out in early January, getting the GAA, loads of different stakeholders behind it. What was your key findings?
Yeah, so we were interested in this study of finding out who's actually taking part in the Ireland Lights Up. There's not really any data on that. So we did kind of a mixed methods research project to see what were the demographic characteristics. Is there equitable access across that? So the main findings that we found were that participants of Ireland Lights Up predominantly female, white, well-educated, affiliated with the GAA, kind of midlife and living in rural communities. Most of them learned about Ireland Lights Up through the GAA. And so there's strong engagement there within those networks. And they had very high levels of health and well-being. But I suppose the take-home message that I wanted to give from the presentation today was that it's absolutely fantastic that Ireland Lights Up are successfully engaging women and rural communities, because those two groups often face barriers to physical activity. It's supporting the well-being and social connection. But there is an opportunity to reach out to other groups. Participation is very concentrated among those who are already connected to sports clubs and socially advantaged groups. So there's maybe not as many young people from lower socioeconomic backgrounds, people who come from other countries, migrant populations, not necessarily knowing about it because they're not affiliated with the GAA.
I guess that's one of the challenges, isn't it? When you're using an existing network and system to get your engagement, we have to put more effort into engagement to get different types of people involved.
Absolutely, yeah. And I don't think it was unexpected to find what we found. I think it's great that it is reaching women and it's really reaching well in rural communities, and that's a big win for it. But I suppose it's an opportunity for sporting bodies, practitioners in health promotion and researchers to really interrogate what meaningful equity looks like. Maybe that is through targeted outreach, maybe it's through partnership with grassroots community organisations, just to try and branch the reach out to people so that we can advance health equity. And that was really the main theme of the presentation.
And how did you collect your information?
It was mixed methods, so we did quantitative surveys through the GAA network. So that was to all participating clubs, so about 1,200 people responded to that. And then for this study, I also did snapshot interviews, so I went out and visited quite a few number of clubs while the initiative was on and spoke to people as we were walking around the track and interviewed them as to why they actually came and got involved in Ireland Lights Up. I suppose the main theme from that was the fact that it was the safety. In a lot of places, the track is the only safe place to walk. A lot of the villages in rural Ireland, it's too dangerous in the winter.
It's a big priority for women as well, obviously.
Absolutely, a big priority for women. And people often brought their children because the children could run around and be safe. So it's the only place to go. There was also social connection was a massive finding and actually feeds into the paper that I'm working on at the moment, which is that is really the active ingredient for these type of initiatives.
The feel-good factor.
The feel-good factor, but also the fact that they were able to connect with people in the community, meet up with people, especially after Christmas, getting out and walking. It was walking and talking with people in their community. And intergenerational walking was a big thing as well. The fact that it was grandparents, parents, children, all out together, being able to meet up in the club. And then that kind of linked into the third piece, which was the club as a community asset. So having the track in the club meant that the club was not just for players and members, it was for other people in the community. And obviously that's what we would love to see being capitalised on, is reaching that out so that everyone who wanted to use the track knew about it, knew about Ireland Lights Up and could come in and have that sense of safety, that sense of social connection, and then that sense of the club and the walking tracks being this community asset for everybody.
I'm now talking to Katie Evans, National Coordinator of the Sláintecare Healthy Communities Initiative in the HSE. Katie, what were you presenting today?
Hi Fergal. I was presenting on increasing engagement in parenting programmes across our Sláintecare Healthy Community areas. So we know that parenting programmes are really effective, but getting people in the door can be quite challenging. So I was sharing how we in the Sláintecare Healthy Communities programme use kind of a practical community-informed approach to increase participation and improve engagement across our sites in Sláintecare Healthy Communities.
And give us some of the learning that you did from that.
The biggest piece of learning, I suppose, was listening to the community. So we did a review with the delivery partners and with our regional Sláintecare Healthy Community coordinators just to see kind of what was working and if there's any changes in the service design that we could make to improve engagement. And they came back with some kind of practical suggestions that kind of revolved around kind of increasing the flexibility in how we deliver programmes or how we want them delivered. Also in terms of improved communications and maybe just more relationship building and trust within the Sláintecare Healthy Communities themselves.
Tell me how you did that.
So we surveyed our delivery partners in 2023 as part of a kind of a national practice-based review. So we sent out a survey to our delivery partners and asked them kind of questions in relation to how they deliver the programmes and how they deliver them, I suppose, in terms of communication, accessibility and programme fit. So we kind of asked them, like, if you deliver programmes in your area, how do you promote them? Like, is it word of mouth or do you use social media, etc.? And then where and when do you deliver them? Do you offer flexibility around that? We kind of asked them kind of basic questions around, like, do you think that the programmes that we deliver at the moment meet the needs of the people in your community?
So I suppose in terms of where Sláintecare Healthy Communities is going, there's an evaluation coming out later this year. It's likely that that type of flexibility and community engagement is going to be something we're going to have to mainstream for everything we do.
I think so. And I suppose just like in terms of what we did with the parenting programmes, we made it much more flexible and we had a really good response in that we've had a 75% attendance in parenting workshops and a 53% increase in group programmes over the last 4 years. So like the changes that we made, like just adding more choice to the programmes that the delivery partners can deliver, updating the kind of communication materials and also building up that kind of relationship and trust with the delivery partners. And we've seen a really good response in terms of like qualitative and quantitative results from that.
I'm now with Health Promotion Officer Rebecca Donanchi, who presented on Making Every Contact Count for Brain Health. Rebecca, tell me more.
Thanks for having me here today, Fergal. So basically, over a year ago, the Health Promotion Department was approached by the ICPOP team. So we were approached by Senior Occupational Therapist Jane Carberry and geriatrician Dr. Tim Duclos. And what we wanted to look at was dementia prevention and the whole concept of brain health. As we know, we currently have about 64,000 people with dementia and it's projected to double within the next 10 years. So what we wanted to look at is research from the Lancet Journal, which shows that up to 45% of cases can potentially be prevented or delayed. And there's 14 risk factors you need to be aware of. So what we did is we picked out 4 of the risk factors, being your diet, physical activity, smoking and eating. And we used the MEC framework, so the 5 A's. And we turned it into a 3-session programme whereby it can be delivered to the public. we have an opportunity to empower them and kind of support them to make positive changes for their brain health, which we hope will help prevent their risk of dementia, basically.
How many people did you deliver that to? Was it the public only, or did you deliver anything to the health service?
So it was just the public, so it was a pilot. So we did 3 sessions in the north side of Cork City, and we partnered up with the community health workers to go out into groups and to deliver this. So at the moment, we're kind of analysing the data and looking at where we need to go next. We know that the data is promising. It shows kind of an increase in people's awareness, their motivation to change and their confidence to change. So we hope that taking that data, we can continue on with programme development, but also looking at the wider context as well. For example, air pollution is a big kind of risk factor for dementia. So there's many other kind of spaces we need to go. But for the moment, we're happy enough with the programme and we hope to continue developing it. So we're making videos at the moment to go into the slides, and hopefully by the end of the year, we'll have it packaged up whereby other groups, communities and HSE staff could take it on to deliver if they wish.
And do you think there's a hunger for more knowledge around dementia and brain health?
Absolutely. I think that it's certainly a topic that is on people's radar at the moment. So people are very aware that, they're seeing people they might know or care about being diagnosed with dementia. They're hearing the figures, they're seeing the stats, and they want to know what they can do about it. And we know a lot of people don't know that there is potential to prevent. And we did get a good uptake in the courses. I think by the time we got to the 3rd pilot, we were nearly turning people away. There was too many people coming in. So yeah, I certainly would say there's an appetite there.
Dr. Dermot O'Donovan is joining me now. He's the Head of Health Improvement in the HSE. He was one of the keynote speakers today. Dermot, what did you hear today that stood out to you?
I liked Jonathan Heller's talk very much. I mean, he's talking about how we need to do things very differently in the way that we work with and for communities. We need to change the way we work. We need to build community participation, engagement, mobilisation into everything that we're doing. And we need to learn from people who are doing it well already, and we need community groups to demonstrate to us how to do it.
And in terms of the importance of having this conference in the context of health equity, in terms of the ambition that you were talking about there and some of the things that you were presenting on, the ambition of public health in the HSE, the ambition of trying to raise awareness and understanding around health inequalities, this event is feeding right into that.
Absolutely. And health inequalities are becoming front and centre all over the place. Like, it's looking likely that the new Healthy Ireland will have a much bigger concentration on health inequalities. We know that inequality generally, we have multiple government departments looking at different aspects of inequality. There are new opportunities to bring groups together around inequality that will ultimately impact on health inequalities.
And you attended some of the workshops earlier. Is there anybody you'd want to give a shout out or anything that kind of struck you?
I thought Anne-Marie Cross's presentation on her work on eco-health and on community knowledge was excellent. I was also really impressed by the work that's going on in Cork around food. And I'm sorry I couldn't get to more.
Yeah, there's an awful lot of content today, wasn't there?
That's a challenge.
It is a challenge. One of the recurrent themes is the sustainability element of equity, as well as health and well-being, traditionally how it's seen, and social determinants. A lot of issues tying all that together.
Yeah, I think there's such core things like that. As I said, like the first principle of sustainable health and sustainable health care is preventing ill health in the first place and reducing inequalities. And action on climate must focus on reducing climate-related inequalities, which relates to health inequalities. So it must all be joined up. And we know that other organisations that we work closely with, like the Health Service works with local government, works with community organisations, have this concentration as well. So we need to weave these things together so that collectively we can do more.
Keith Ryan is joining me now, and he was involved in delivering a project in relation to vaping, young people prevention in Tallaght. Was it, Keith?
Clondalkin and Tallaght, yeah.
Yeah, tell us about it.
So yeah, it was a campaign called Kick the Vape. It came about through a partnership with ourselves in health promotion and improvement in Clondalkin and Tallaght in the Sláintecare Healthy Communities Initiative. And we partnered with the Clondalkin and Tallaght Drug and Alcohol Task Force and South Dublin County Partnership to respond to the increase of prevalence of vaping in both communities.
And this predated the HSE vaping campaign. I suppose there was so many stakeholders and concerned allies raising their voice about vaping. I presume this was a response to that.
Yeah, there was so much concern coming up across several kind of community working groups that we were all members of. So a decision was made to establish a working group to develop a local response to this.
So what did you do? Tell us.
So what we done was we developed a number of resources, both print and digital, which included posters highlighting the harms or potential harms of vaping in the areas of mental health, physical health, financial health and the environment. We developed an information leaflet We developed a podcast and a short animated video. And then we launched the resources in TUD, the University in Tallaght.
And did you get any feedback? Are we able to assess any outcome?
We didn't evaluate the project, but kind of locally from speaking to professionals, and in particular, we worked closely with a couple of youth organisations. They were reporting that they kind of had increased confidence in speaking to young people and using the resources within their own programmes. And I know locally in Clondalkin and Tallaght too, the both drug task forces implemented the resource into their skill-based programmes.
Increasing the confidence of people working with young people to be able to have that conversation is huge, because I suppose this is still an emerging area. The HSE has some facts and information available, but they're relatively recent. Like the whole phenomenon of vaping is recent.
That's it. There's been such a surge in vaping, particularly among young people, that people locally don't really know where to turn, and they were kind of knocking on our door in the tobacco services locally in Clondalkin and Tallaght, seeking advice. We were getting calls from parents, from youth organisations, from schools. We were aware there was resources developed by Tobacco Free Ireland, our national leads, which we were able to draw from as well. But just at the time, it was really important that we were able to kind of group and have a local coalition or response to what was happening and the concerns that were being raised. You can see it everywhere, young people vaping and adults, and then the vaping related litter as well.
Yeah, I think the environmental element isn't fully appreciated. It is very anti-environment. They're so disposable, a lot of these products that have been made.
Exactly, and that's what we wanted to highlight, that part, the environmental aspect, as part of the campaign as well. And one of our posters addresses that specifically, because we can see it everywhere, the litter, and it's directly linked with the increase in the availability of the disposable devices. It wasn't as prevalent when vaping first came to Ireland because people were using modifiable tanks. You could charge them and reuse them, but with the single-use devices, that became really apparent, of the environmental impact.
Dr. Mary Jo Lavelle is joining me now, and as well as working as a lecturer in health promotion here in Galway, she's been one of the co-chairs of the development and organisation of the conference today. Mary Jo, tell us, what it's like for you?
Thanks very much, Fergal, for inviting me to your podcast. We've had a fantastic day. We've had over 240 delegates, as you know. We've had a full house. We've had a really fantastic lineup and programme for this, what is our 30th annual health promotion conference here at the University of Galway. So we've had 4 international and national keynote speakers, as you would have interviewed earlier, Professor Louise Putvin, Professor Diarmuid O'Donovan, Dr. Jonathan Keller, and of course, Professor Sharon Friel. So we've had a fantastic day of keynotes, of oral presentations, poster presentations, interactive workshops and lightning talks. This really has been a very, very packed schedule and programme of events. We're honoured to host the 30th Health Promotion here with our partners, the HSE, the International Union of Health Promotion and Education, the AHPI, Healthy Ireland and the Department of Health. It's been fantastic.
Well, can I just say congratulations on a great event, and well done to your team behind the scenes that have pulled it all together. There's a lot in organising a conference, as you now know.
Yes. Oh no, that's an understatement, Fergal. We have a fantastic group and a team here working behind us from the discipline of health promotion and also from the Health Promotion Research Centre. I can't start naming names because there's just too many people, but in terms of the setup, in terms of the development, in terms of all the planning that goes into that in the run-up to the event and also during the day. So we have a fantastic team led by my good colleague Elka Rika, Stacey Gibbons and Fiona McInerney, just really who I'd call the dream team. They're fantastic. But we've had a lot of work. It's taken a lot of planning over the last number of months to really come to this stage. But I think it's been a hugely successful day, and feedback just anecdotally through the coffee breaks has been very, very positive.
Well, that's it for this episode. Hope you got some valuable insights. Please share the episode with your colleagues, and thanks for listening to another episode of the HSE Talking Health and Wellbeing podcast.